Namaste all of you. This is Devan Rahul Sharma. I am Assistant Professor of Microbiology in FPT Department of Vidyapeeth Women's University. So today's topic is tuberculosis, and I am dispensing this topic for BMLT second year student. I have covered so many topics in my previous videos. So students, if you have not watched the video, please go through them. And if you have any query related to your topics and related to your upcoming topics or any query, so let me know in comment section or in class. Okay, so today's topic is tuberculosis. So there are so many type of diseases I have to teach you, like leprosy, tuberculosis and all. So today I am discussing the tuberculosis topic for you. Okay, so you know very well what is tuberculosis and what is this is also called TB. So the full form of TB is tuberculosis. Okay, and the causative agent for this disease is basically mycobacterium tuberculosis. That is a causative agent, and this disease is solely of the lungs, and it affects the lungs, and so basically this bacteria causes the pulmonary tuberculosis. So don't be confused with the tuberculosis that there are so many students only think that the tuberculosis only occurs in lungs. So yes, various type of tuberculosis in our body we can suffer, like the tuberculosis of the bones, tuberculosis of the heart, tuberculosis of the CNS, tuberculosis of the lungs. Okay, so there are various type of tuberculosis basically. So I am starting the tuberculosis topic. So tuberculosis is a contagious infection that usually attacks the lungs, and this is a bacterial disease. Okay, the mycobacterium tuberculosis is the bacteria that cause the pulmonary tuberculosis in human being or in animal also. So it usually attacks the lungs. It can also spread to the other part of body, like your brain, your spine. Okay, so the type of bacteria called which is the causative agent for tuberculosis, that is mycobacterium tuberculosis. Okay, so it causes the tuberculosis of the lungs. So the question is, can tuberculosis be cured or not? Okay, so in 20th century, TB was a leading cause of the death in United States, but today most cases are cured with the antibiotics, but it takes a long time. Okay, like 6 months, and it requires the regular treatment, no skip treatment. If you are skipping your treatment, so you will start the treatment again from the 0 dose. So you have to take the medication for at least 6 to 9 months. Okay, according to the WHO for the tuberculosis. Okay, and there are so many countries throughout the world which has completely eradicated this disease, but this disease is spreading day by day in developing countries, because the amount of the indigent people or poor people are more there as compared to the developed countries. Okay, so there now I am discussing about the types of tuberculosis. So a tuberculosis infection does not mean you will get sick or not. There are two forms of disease. So actually tuberculosis disease is basically it attacks the immune system. So if you are having the low immune power in your body, so it can attack. If you are having the strong immune power, intact immune power, immune system is enough to fight against the bacteria, so you will not suffer from this disease. Okay, so like there is one type of tuberculosis, that is latent tuberculosis. So you have the germs in your body, but your immune system keeps them from the spreading. That is called latent tuberculosis, as I discussed. So you did not have any symptoms, and you are not contagious. Contagious means the disease can spread very fast and can spread by sneezing, coughing. Okay, if you are coming in the contact with tuberculosis patient. So such type of diseases are called the contagious disease. And the latest example is the COVID-19 coronavirus. It is also contagious disease. It can spread one human to another human by coughing, sneezing, and if you are coming in contact, it can also spread. Okay. So but the infection is still alive. So can one day you become infective, but that day will come if you are having low immune system, low immune power. Okay, that is called comorbidity condition. Comorbidity, like you are having the another disease along with the tuberculosis. So if you are suffering from the another disease that is basically attacking your immune system, so the later infection can be activate again, and you can suffer from the tuberculosis. So if you are at the high risk for reactivation, for example, if you are having or if you have the HIV, so you had an infection in past 2 years, so your chest X-ray is unusual and your immune system is weakened, so your doctor will give you the medication to prevent the active tuberculosis. Got it? So next is the active tuberculosis. So active tuberculosis, like the germs multiply and make you sick, so you can spread this disease to others also. Okay, if you are coming in the close contact with the other people, other folks. So 90% of the active case in adult comes from the latent TB infection. So a latent or active tuberculosis infection can be drug resistant also. Drug resistance means you are taking drugs against tuberculosis bacteria, but the drugs are unable to treat you. The bacteria doing resistant against those drugs you are taking, so you will not have any relief from those drugs. So that is called the drug resistant. Okay. So drug resistant meaning certain medication don't work, especially against the bacteria. So now I will discuss about the sign and symptoms. So how will you get idea that you are suffering from tuberculosis or not, and what are the symptoms? How will you identify whether you are positive or negative for tuberculosis? So tuberculosis, the latent infection, does not have any symptoms. Why are you not having any symptoms? Because your immune power is intact. Your body is able to control that bacteria. So if your body has a controlling power on that bacteria, so your body will not show any type of symptoms. Your body actually shows the symptoms when your body is unable to control on that type of thing. So the latent tuberculosis infection does not show any symptoms. So a skin or blood test can tell you are having or you are suffering from tuberculosis or not. Okay. So the sign of active tuberculosis is like a cough that lasts more than 3 months. Okay. So this is the main symptom for the tuberculosis, that you are suffering from the cough since 3 or 4 months. Okay. Chest pain, you may have chest pain. Okay. Coughing of blood, if you are coughing, then your cough is mixed with the tinged blood. If you are having the tuberculosis, you may have blood also in your cough, so it is also main symptom. Okay. feeling tired all the time, you are not feeling active, you are taking various type of drugs to become active. So if you are having such conditions, so you may have tuberculosis. Okay. There are so many type of diseases also along with the tuberculosis. In those you feel tired all the time, but tuberculosis also has the same symptom. Okay. Night sweat, you may have sweating at the time of night. You may feel also from the chills, you may feel cold like the as you feel during the malaria fever chills. So you may also feel you also suffer from the chills in the tuberculosis fever. Loss of appetite. Loss of appetite means your body is unable, or your liver is not doing well, so you are like you are not feeling well, and the your internal system is unable to get the thirst and like the requirement of the food. So this is also the main symptom that your weight will be lost also. If you are not eating anything, you feel all the time that your body is not able to eat. Your body is not indicating, not responding for the food. All the time you are showing that I am not able to eat. So weight loss also the main symptom. Okay, so these are the symptoms. So if you are having the symptoms like these, so you may go through the diagnosis, blood test for X-ray to identify whether you are positive or not. Okay, and first you have to go for the physician. The physician will suggest you for some diagnosis like blood test and X-ray. Okay, and so the tuberculosis spread through the sneezing, through the coughing, and you are coming in the close contact with such patients. Okay, so you may use mask and don't go in close contact with such patients. And if you are suffering with, if you are thinking that you are having the symptoms like tuberculosis, don't spit in open areas. Okay, so if I'll talk about the diagnosis, so you may go through over the acid fast bacillus test, that is the bacterial test. Okay, chest X-ray you may go through, tuberculosis skin test, tuberculosis screening, the prevention or the BCG vaccine, that is bacilli calamite variant vaccine. So it is the vaccine prepared for the tuberculosis patient. If I'll talk about the treatment, staying on track with tuberculosis medicine, that is under the control of the Center for Disease Control and Prevention. Treating and managing the tuberculosis under the American Lung Association. Treatment the latent infection and tuberculosis disease. Okay, so the doctor will suggest you some medication, and you have to take the medication for at least 6 to 9 months. And the main suggestion from doctor side is don't skip any single dose. If you are skipping any single dose, you have to treatment start again from the 0 dose. So today I have discussed about the tuberculosis, the types, positive agent. Okay, and this is the acid fast bacilli. Okay, this is the bacilli. Okay, gram positive bacteria. Okay, so the topic is over. If you have any problem related to your topic, let me know next class. So thank you so much for watching this video. This is pandemic time. Everyone is suffering from the coronavirus, and the suggestion from my side is be safe at home. Don't go unnecessarily. Take care of yourself and your family members, and take some precautions on time. Use mask, use hand sanitizer, don't go outside unnecessarily. Be healthy, be safe, and do study hard. You are at home, so I think you are free all the time, so you may study if you want, and it is a golden period for your study. So thank you so much. Namaste. See you next time.